Thank you to all of you to come in such a large number. Let me introduce myself. I am Dr. Devraj Josh. I am head of the Department of Pulmonology of Manipal Hospital of Broadway, Salt Lake and EM Bypass. Now, when we talk about pulmonology, what are the diseases we are dealing with pulmonology? Number one, what are the diseases we are treating in Kolkata which are not done at Mizoram? And what are the interventions what we are doing, what is rest of the eastern part of the country is not doing? So first let me discuss about pulmonology. So pulmonology means anything related to lungs. And what are the diseases which we deal in pulmonology? It starts from basic diseases like allergy, asthma, then COPD, then interstitial lung disease, fibrosis, the word which we heard from the COVID, that fibrosis, then bronchiectasis, bronchitis, water in the lung, one of the most important, like you had pleural effusion, that is water inside the lung, that is very important. Why there is water inside the lung? What is the reason? How, what to do, how to do, and how to approach? Bleeding coming out from the mouth, very important pulmonary disease, bleeding from mouth. And also lung cancer, because we all know, and particularly in Mizoram, lung cancer is a very prevalent disease. So lung cancer, you need to diagnose first. If you don't diagnose, how are you going to treat the lung cancer? So how to diagnose the lung cancer? By doing bronchoscopy, by doing EBUS, by doing thoracoscopy, and when you diagnose the cancer, how to relieve the symptoms? If you want to relieve the symptoms, you need to cut the tumor, you need to remove the tumor, you need to put a stent on that patient. So these are the things what we do in pulmonology. Another thing of pulmonology nowadays is sleep study, sleep study. So whenever any one of you is obese, snoring, falling asleep, so whether you have sleep apnea or not, for that we have a dedicated sleep lab in our hospital which diagnose whether you have sleep apnea or not. We give specific treatment for sleep apnea. What are the other approaches apart from CPAP in those patients? What are the surgeries what we can provide to those patients? We have a comprehensive multidisciplinary sleep apnea board in which we collaborate with our ENT friends, our dietitian, our endocrinologist. Nowadays they are using lot of the injection in reducing the weight, you know, the semaglutide one. So we have a comprehensive pulmonary department. We have a dedicated pulmonary rehabilitation program going on with us, which is very important because any breathing disorder patient, they are unable to work, and it's like a machine. If you don't make your machine work, it will cease to work. It will even cease to function. So it's like body. However sick you are, at least little bit of activity you should perform. If you do not perform those kind of activities, your body gradually with time and time will become more and more sick. Just 1 minute. হ্যাঁ রাইসিকা বলো, একটা মানে পাঁচটায় কালকে রেখে দাও না, কালকে তুমি 10টার পর থেকে এনটিএম রেখে দাও, দুটোই করে দেবো আমরা। ঠিক আছে। হ্যাঁ হ্যাঁ হ্যাঁ। So these are the things what we are talking you with you. Another thing is that the lungs and heart are very closely related. So many of the patients of breathing disorder, even if though they are having cardiac problem, if they do not consult pulmonologist, they will not have optimum cure. And last aspect, what I am coming to you is pulmonary critical care, like the ventilator, ECMOs. So those are the things We at Manipal Hospital, we have dedicated respiratory care unit in which only we pulmonologists are treating the pulmonary patients at our ICU, and all the Manipal units, be it Broadway, be it EM bypass, have those infrastructure, those manpower with us who are expert in dealing with such critically ill patient who require ECMO, who require ventilator, those kind of things. So pulmonology, as I already told you, starts from allergic disorder, asthma, COPD, bronchitis, bronchiectasis, interstitial lung disease, fibrosis, bleeding from mouth, water accumulation inside the lung. Also, many investigation like lung cancer diagnosis, and for which bronchoscopy, thoracoscopy, EBUS, treatment of lung cancer, removal of the tumor, sleep study when you are suspecting obstructive sleep apnea, and at last we have a dedicated pulmonary critical care unit in which we are treating the patient severely ill with ECMO as well as ventilator. And we have a multidisciplinary discussion with our cardiologist friend, our critical care friends, with all of them. Now I invite you, all of you, for any kind of questions which you have in your mind, don't hesitate to ask. Any kind of question.
If anybody has any kind of questions, they can please ask because he is available at Mumbai Bus Unit because you all came to Kolkata. Many of you came to Kolkata. He is available at Mumbai Bus Unit as well as Broadway and Salt. So if any questions you have, I think you also came to Kolkata. I don't you did not come. Okay. I would request if anyone has any questions.
Anyone, any question regarding lung or pulmonology if you want to ask, or regarding Manipal hospitals
Yeah.
also.
Any questions regarding Manipal Hospital, the facility and the treatment?
Yeah, so what is the specialty of the Manipal hospital? Why should people go to Manipal other than other hospitals?
Like now it has been 2.5 years, so Manipal has got 5 hospitals in Kolkata and 7 hospitals in eastern part of the country. So, in a small place of Kolkata, if you have 5 hospitals, previously some hospital has got a good palmo department, some hospital has a good onco department, some hospital has got a good gastro department. So, 5 big hospitals in a city like Kolkata, you can well assume that if you add all the 5 hospitals, you can have the treatment under multiple groups but same brand. You can choose your physician. Many a times you consulted one physician, you are not happy with that physician. Because the Manipal chain, we have 5 hospitals, you can consult any physician at any of the unit. It is not that you need to go to other unit to have the opinion of that physician. If you ask that physician, all units are working in close liaison with each other. Second thing is that when we talk about Manipal, starting from the Bangalore Manipal, why people from eastern part of the country go to Manipal is because of the infrastructure and is because of the relationship with the patient and the quality of care what they used to give. Kolkata, another thing what I can tell you, since you raised this question and I am a pulmonologist, barring 1 or 2 hospitals do not have that kind of infrastructure, both in terms of manpower as well as in terms of instrument and machine, what we possess. So this is the reason, and if you also now have a tie-up with the government, so based on the tie-up, you also had the provision of having the cashless treatment also. So these are the things which I think is an enough reason for any individual from Mizoram who want to have a treatment from outside the Mizoram to go to Manipal, Kolkata.
What are the common cases from Mizoram?
In pulmonology, we have a lot of lung cancer patients coming to us. Second, we have a lot of interstitial lung disease patients who are coming to us, and also COPD patients coming to us.
Okay, regarding this COPD, due to smoking.
Yes.
How do you treat the patient and especially sleep apnea? And one more thing, if there is the breathing problem, so the patient will be should be put the patient in best like sleeping position or sitting position.
Sir, you raised a very important question. So first, let me come to COPD. COPD is mainly due to smoking, but it is not the only reason. Nowadays, in female individuals, we had a lot of COPD patients. Many of them are non-smoker. So pollution, genetic reason, other diseases are contributing to the COPD also. So you need to assess the COPD in non-smokers also. Second part, sleep apnea. For diagnosis of sleep apnea, you need to do a good polysomnography. Polysomnography means sleep test. Polysomnography means sleep test. So how you get the sleep test done? You get yourself admitted at any of the hospital for a single night. You come around 9 p.m. or 10 p.m. Then an individual will put some wires and will monitor how you're breathing, your pulse rate, your oxygen saturation, and that will be kept for across the night. And then they will monitor how many times the breathing is stopped, oxygen level going down below a certain level. So based on that, they will put certain machine for the treatment. Why we sleep? We sleep because our brain want oxygen when we are sleeping. They want some rest. But in sleep apnea, there is low oxygen in the brain, so brain doesn't work fine. That is the reason you need to diagnose sleep apnea. If you do not diagnose sleep apnea, you will miss the treatment of sleep apnea.
Yeah, right.
How many sorts of cancer is like?
Sir, I can't hear your question. You give na?
By the Guruji therapy, how many types of cancer?
Cancer.
Yeah, you can
So
examine.
in pulmonology, we are mainly dealing with lung cancer because pulmo means lung. But also in lung cancer, it has got at least 20 varieties. Because nowadays the treatment of lung cancer has changed. It is not previous just giving one or two chemo drugs. Nowadays we are giving targeted chemotherapy, means specific drugs. Apart from lung cancer also, as a pulmonologist also we get thyroid cancer. Many a times patient present to us with hoarseness of voice, so we also have vocal cord cancer, CA larynx. So but predominantly we pulmonologists see lung cancer patients. Lung cancer depends upon the stage at which it is diagnosed. If it is diagnosed below stage 3, there are 4 stages. 3B and 4 onwards, treatment is chemotherapy, so it is not curative. 3A, up to stage 3A, treatment is surgery, which is entirely curable. So it depends upon at which stage it is diagnosed.